Now I would like to invite on stage our next speaker who has been practicing homeopathy since 1994 in Powai, Mumbai. Worked with Institute of Clinical Research in Homeopathy for past 10 years. She has worked with children suffering from autism, dyslexia, Down syndrome, conducting webinars for doctors on various topics of homeopathy and sex education. Dr. Nirupama Agarwal. Have a big round of applause for ma'am.
Good afternoon, friends. So, since morning we are seeing all pathologically advanced cases, right? Which needed a lot of experience and a lot of confidence. Now we are going for a very, very simple case of anxiety disorder. Our bread and butter remedies. Huh? Initial days of the practice, we have a lot of time. Patient come to us with anxiety. They share their problem. We listen to them. They feel better. After some time, they come again. That is how our practice goes on for some time. And so it's very important to listen to them. As sir said in one case, he just told patient communication is needed. But with breaking joint families, this communication is also breaking. And there is no time in nuclear family. Everyone has a lot of stress, but no one has time to listen to other person, and that is how anxiety problem goes on increasing. But when patient keeps coming to you, just to someone who is giving them that ear, that doesn't mean it's a right sign. They are becoming dependent on us, and we are not treating. So just see this case, extremely good case of anxiety disorder, very simple case. So this is 39 years old lady, married, she has one son and working. She was coming to me before this also. I've written case actually reviewed on 14/6, recently reviewed. But she was coming before that also for few symptoms here and there. And now when she came to me, there was lot of anxiety. And along with the anxiety, there was huge guilt and lot of negative thoughts. So how it started suddenly? She was coming for so many months to me before that also. I could feel that anxiety in her, but she never shared it. And this is the time, see, when something suddenly triggers, it's the best time for us. Acute disease is the time when you can go deeper in the patients and you are able to crack a lot of remedies. So what happened? This time, husband, see, this was their marriage was like, patient was Maharashtrian and married to Marwadi. There was huge issues, like she was from a nuclear family, went to joint family. She was not happy with the joint family. So she wanted to separate for long. And husband was really trying hard for it. And now when husband got that opportunity, when husband told in the family that I've got transfer to another city, this lady came up with lot of anxiety. Lot of anxiety, what will happen? Will I be able to adjust in the new place? Will my child will adjust to the new education system? Will my parent-in-law will settle here? Who will look after them? See, so many things are going on in her mind. So, and then what was happening, everyone was knowing that she wanted to separate for long, and that's why probably her husband tried for it. And that's why a lot of guilt was coming. Am I responsible for it? If something happens to them, heart attack, stroke, paralysis, who is responsible? People will blame me. And a lot of things were going on, and continuously in-laws were crying, let's stay together, don't go away. Next. So I just inquired why was this guilt, and everything I told you. Next. So now what it is? It is just the acute phase, or it's the acute exacerbation of the chronic illness, or slowly progressive chronic disease. How are you going to manage? Are you going to give acute? Are you going to give chronic? Or what you want to do? So little bit deeper I went. So history went like this. After marriage, immediately after marriage, she developed a lot of IBS symptom. And patient was treated with homeopathy. She settled down. She said, I got married to Marwadi family, but I was not knowing their way of living. I was not knowing how to cook. And from where to start? What should I learn? How to manage? So many questions were coming in her mind, and with that lot of fear, she developed IBS. And then she said, mother-in-law was very strict. She was very demanding. She wanted me to cook, but problem was I'm from a non-vegetarian background. Marwadis were very strict. They don't allow us in their kitchen, and she was not allowed in her kitchen for pretty long time. So there was no acceptance. Then there was a lot of comparison with elder sister-in-law, Jethani. She was Marwadi, she was doing cooking well, she was managing home well, everything. So there was a lot of comparison with the elder sister-in-law, and she was continuously finding it difficult to manage. So what she did, see now how person is reacting. See, there is a stress, what type of stress, and then how person is reacting in that stressor is very, very important. What she did, I reduced my communication. Important, huh? I reduced my communication. I took all the responsibility of the family. I looked after my in-laws. I looked after the guests coming home. I managed everything, but I stopped the communication. Very important, huh? This remedy has this important aspect, communication. And I always had this performance pressure. Like, what if I fail? What if my dish doesn't come out well? What if guests are not happy? See, the performance anxiety. Then you have to go back. Now, since when this performance anxiety is there? Next. So this acute episode I have taken. So she said, lot of unknown fears. I don't know what is causing this anxiety. But doctor, when I lie down, my heart rate goes up, lot of palpitation. My body starts shivering. पूरा शरीर ऐसा उछलता है डॉक्टर मैं सो ही नहीं पाती super anxiety patient's word super anxiety I feel lot of tension in my neck and back muscles I'm not able to sleep what I do I get up and I start working because I just cannot handle this sensation where my whole body shivers और वो उछलने लगती है and very characteristic was my this observation. She was sharing acute episodes, she was sharing her past things, but there was absolutely no eye contact. She was talking like this. She was giving me all the information, but she was not looking at me. She had come before also for her son's treatment, and that time also I was feeling, why she is not looking at me? So this was very important observation, which made this remedy very clear for me. Next. So since when this anxiety is there? Very important to find out since when it's there. So I was always been anxious. There is lot of anxiety before exams. There is lot of anxiety before traveling. Till I reach destination, lot of negative thoughts about accidents, death, lot of problems. So all the thoughts are negative. I was always been introvert, very quiet person. People used to call me डरपोक child. एकदम डरपोक लड़की है, which I can feel. I was good in studies. I always used to study, but no extracurricular activity. What extracurricular activity needs? Communication, courage, confidence, right? But there was no extracurricular activities. Lot of stage fright, and there was lot of fear that people will laugh at me. Next. How were your college years? I was always been good in studies, but college years were special. Why? It was a big classroom. I was not seen in the classroom. I felt so relaxed, teacher is not looking at me. I was extreme, that's why I could enjoy my college days. And there was one incident, this incident is very important. Although it was a past incident, but its impact is there in her. And this is very important, which I have seen in various cases of this remedy. this type of incidents comes. So there was one incident, there was meeting in a closed AC room. It was a small room where meeting was going on, and suddenly she developed anxiety and she felt a lot of rumbling and gurgling in the stomach. And she said it was so loud other people can hear it. And I felt so uncomfortable with that sound. I literally felt embarrassed in front of so many people, and this impact remained in my mind for pretty long time, and I used to feel very uncomfortable in closed room. Now it's better, but still I'm uncomfortable. Next. General symptoms. She developed hypothyroidism at the age of 14, at the time when she developed menses, at the time of puberty, and she is on Thyronorm 50 since then. Appetite is less. I always feel very weak, craving spicy, but I enjoy outside food. Tendency for constipation. There was history of painful hard stools. I have habit of hair pulling. When I think, I keep pulling my hair. My sleep is always disturbed. I get up with startles. Lot of fear of falling from height. Patient is chilly. Next. Very characteristic dreams. Huh? Me and my husband have gone somewhere. Husband has gone somewhere, and I'm searching him. There is a lot of fear where he has gone, and what if something happens to me? There is a lot of fear of being killed, fear of being raped, fear of being harmed. There is a dreams that I'm falling from a very high place and dhadam se मैं गिर गई. See, this dhadam se has also some meaning in this case. Shok sabha is going on. Regular conversation with husband and see how many places you see communicate. I stop the communication, dhadam, and regular conversation with my husband and children. Next. Anything coming to your mind? We're going faster. Anything? Few remedies if you can tell me. Argentum. Anything else? Backside. Any remedies? One or two remedies? Okay, next. So for me, it was a animal kingdom. She has focused a lot about the family, mother-in-law issues, sister-in-law comparison, lot of about comparison, acceptance, communication. So this is all the animal language, and dreams are very characteristic, being killed, kidnapped, raped. Next. And there were a lot of mammal issues. Issues about the family, children, issues about the responsibility. See, she is from nuclear family. She always wanted to go back to nuclear family, but she has come to the joint family. But when she is going again for the separation, so much guilt comes up. So she has developed that relationship with in-laws, and now she's feeling guilty of separation. She feels responsible for her family. It's very important to understand she's wholeheartedly taking responsibility of her parent-in-laws. Huge guilt. Nuclear to joint, joint to nuclear, very low confidence and self-contemptuous. What if I'm blamed? So these are typical mammal issues. Next. So remedy given was ambrogracia. If you see the incidents, rumbling and gurgling in the closed room, the loud sensation, I feel embarrassed, no eye contact. Patient was coming to me for so long, for her son's treatment also, for her own. See, she's sharing everything with you. She's telling you but why she's not looking at you? Not a single time she looked at me. And I was just surprised. All the books are talking about no eye contact in ambrogracia, but I had never seen this and how I should understand from the disease language. So if you study ambrogracia, there is a lot of social anxiety. They perform well, but there is a lot of social anxiety, and that restrict them from the communication. that restrict them from the eye contact. So if you see the mind of Amerogracia, in this case, elements from new environment, change of place, low confidence, no eye contact, and embarrassment. Physicals, I get up with starters. See, Amerogracia has a lot of stomach complaints, anxiety issues, and lot of nerve issues, startling, numbness, tremors. All these are the symptoms of Amerogracia. So she said, I get up with startle with lot of fear. She said there was a history of constipation with painful hard stool, history of hypothyroidism. See all the C remedies, where whatever C remedies if you see, they have possibly these thyroid issues. So whenever cases of hypothyroidism comes, do think about the C remedies also in DD. And the typical presentation of anxiety is trembling of whole body. See, trembling, nerves issues, trembling, palpitation, heart issues, sleeplessness. So either you see extreme sleepiness or the sleeplessness, and the anxiety felt in neck and back muscles. See, most of them are common symptoms of anxiety, but Amerogracia has these three regions: nerves, stomach, and palpitations. So all the three components were there, and with that I've prescribed Amerogracia next. So with Amerogracia, her anxiety settled down. So initially when she came to me, she had a lot of anxiety. So I kept her on weekly doses for some time, and anxiety really settled down. But I continued it once in a month for some time, because anxiety was there for pretty long time. Like every small trigger, every small problem used to give rise to anxiety. Now anxiety is much settled, and husband has got call from US now. They are shifting to US, and she said, डॉक्टर एंजाइटी अब इतनी हावी नहीं होती मुझ पे, हाँ मुझ पर हावी नहीं होती. एंड whenever anxiety comes, she is able to divert herself, she is able to do some other work. Next. So thank you friends. If you have any questions, you can ask me. There is one more, like I'm taking regular Thursday lectures on PM and homeopathy on Engage platform. If anyone wants to join, we are continuing these lectures from coming Thursday. Thank you.